Health channel, and today we're going to discuss wireless paramedicine. We're going to learn all about it, what its impact is on patient care, and what its impact is on our healthcare system. Joining me today for the discussion is Chief Jeff Brooks. Jeff is from Lambton County, which is a county in Ontario, out in the Sarnia area near Lake Huron. So, Jeff, welcome.
Thank you.
Thanks for joining us today. So, let's start off maybe just by describing what wireless paramedicine is. You know, some of our viewers will be quite familiar with it, and others are probably new to the concept.
Sure. So when we talk about wireless paramedicine, there's a number of components to that. So it could be something as simple as the ability to upload real-time data, whether it be vital signs, electrocardiogram tracing, and that type of information to a physician or to a hospital. Or it could be a live video feed where we have the ability to link into a physician and be able to have him view the patient in real time and even carry on conversations, ask questions, and do a virtual assessment as need be. So virtual paramedicine incorporates a lot of things, and I would say even into the home, where now some patients will have a home monitoring system in absence of a paramedic, where once a day or a couple times a day they can hook up to it, and a physician or a health team can see the patient's status, whether it be their current vital signs, respiratory effort, all that type of thing. So,
excellent. And as I understand it, the idea here is to leverage the paramedics that a community already has in place, try to leverage them on a non-emergency basis to have them extend outreach and care by making visits to patients or people within the community that have been identified as needing some support within the community, and maybe by making those visits on a non-emergency basis, you prevent the emergency call and having to transport somebody to the emergency room.
Correct. There's sort of a couple, things in play with that, and there's some things I think are coming. So the one is the paramedic team or health team that can go to identified patients or clients and can provide them support in the home with a link to a health team to prevent them from having to go into the emergency department. The other piece of that, which I hope we'll see in the not-too-distant future, is the ability of a paramedic to go on a call even when someone's called 911, and with that link to virtual link to a physician or to a health team, a decision will be able to be made that this patient maybe doesn't need to go to an emergency department, that the care they require they can get at home, and that saves the patient ending up in the wrong stream of care. And I talk stream of care. Emergency departments are great for some things. Patients that require different types of care often end up in the emergency department because they don't know where else to go. And that's when we get this sort of revolving door syndrome, where the emergency department isn't really the place for them. They don't really get treatment because that's not where they need to be. They go home, and then we bring them back, and we have this sort of this cycle. So by getting them in the right stream of care, we can certainly ensure that they get what they need to get, takes the burden off the systems that they don't belong in, and virtual paramedicine and community paramedicine are certainly ways to help achieve that.
Who are some of the partners that get involved with this? I mean, obviously the paramedic corps within the community. I imagine the local hospital that's supporting the community, but does the local health network get involved? Who else gets involved in it?
There are a few critical partners. So certainly our local hospital, an emergency department, and the physicians there are a critical component, as is our base hospital. And for those that aren't familiar with paramedicine, every ambulance service, every paramedic in Ontario, and in most places, are tied to a base hospital where a physician provides us with orders to treat patients. And some often with a standing order, but we need to be tied to a physician to do that. So our base hospital program is critically involved in that, setting some of those teams. So,
but I think this is an important question on obstacles And also important to understand, is there a network of peers that people can exchange best practices? Because this is well, it's not only a Canadian conversation; it must be a conversation globally.
Yeah, I think it's very much an international conversation, and I know through the Association of Paramedic Chiefs that there are discussions, and I believe there's actually an international conference down in the States that's happening soon. Jeff, you're back with us.
I am. Yep. I had to go grab cream and sugar.
Good for you.
David, given the challenges, I think we're doing pretty well at Starbucks. Maybe we want to have Jeff sort of give us some closing insights and closing thoughts while he's online.
Yeah, certainly. And, yeah, go ahead, Jeff.
I think as we move forward in healthcare, one of the big driving factors, as in any business, is certainly cost. And I think that, we have to be careful that, cost doesn't drive the process. But I think we have a unique opportunity here because not only can we show that we can save costs, but we can also show that we can provide better care for the patient and a better, more efficient operation in the system. So, a lot of times when we look at how can we save money, it often means reducing service. And in this case, I think we can, really do what's best for the patient and make the system more efficient at the same time.
I agree. Very, very good points. Very, very good advice. And I imagine we have pilots underway, or we're attempting to measure this as we move forward.
There is a very good pilot is ongoing right now in New York region, where they're doing some very amazing things with community paramedicine. They've done special training for some of their staff, and they're sort of increasing their scope of practice from that perspective. And a lot of communities, including my own, are really getting involved in outreach, not so much from a technology perspective right now, although we do now have the ability to transmit vital signs, electrocardiograms, and that type of thing directly from our vehicle to the hospital. But we also have the connections now in an outreach perspective. So when we have a patient that we feel would benefit from additional services in the community, we can put a code on our ambulance call report, and our local health network is automatically notified of that call and that person, and they arrange for a home visit and an evaluation to see what is available for that person as far as other services go. So that's becoming quite common in Ontario now, those connections, and I think that's a critical thing. And the paramedics are really in a unique position because we're the people that see the patient at home. We see them in their natural environment, if you will. We see how they're taking their medication. We see the state of their home and how clean things are. And those are often good indications as to how well they're coping and how well they're doing. And by taking them to the hospital, they don't really get that picture the same way we do. So, we're in a unique position. We're able to provide that feedback. We're able to see that stuff, and I think that's a huge benefit.
Great. Well, I mean, this has been very, very helpful and a very interesting conversation. I think we'll do more. I mean, I think there needs to be a little more awareness of what's going on in this space, and I'd be happy to have you back and maybe with some of your colleagues and chat about it some more.
Yeah, I agree, and I really appreciate the support from CATA. I appreciate the opportunity to have these discussions. It's certainly something that has been near and dear to my heart for quite some time. And as I've been a practitioner for a number of years, and I've dealt with these patients, and I'm fortunate enough in my position now that I can see the impact, and I know that the patients that we're dealing with and are able to provide these referrals and services to are doing better. They're happier, and at the end of the day, the patient wins, and that's what we're all here for and what we need to ensure.
Absolutely agree with you. Patient care, patient outcomes, absolutely priority. So this is Dave Farnes for CATA TV. Chief Jeff Brooks of Lambton County has been joining us to talk about wireless paramedicine. I want to thank you, Chief Brooks, for participating. So I'll sign off now. This is CATA TV, the mobile channel.